right, I'm going to be demonstrating inserting a nasogastric tube and removing a nasogastric tube. First I would go into my bedroom and check my physician's orders. I have a physician order for 0800 on 1019, excuse me, 0800 1019 for Joanne Jones to have an NG tube inserted. So Joanne Jones, her birthday's 12/3/67. Dr. Moberg has written the order. Allergic to penicillin. She has a bowel obstruction. So I would make sure that I have all my supplies, cup of water for swallowing, gloves, gag bag, chuck, my tubing, tape, lube, pen light, strips, all that good stuff. So then I would do another check once I'm outside of the room, ensuring that I have Joanne Jones 12/3/67 as a birthday. Dr. Moberg issued the physician's order to insert the NG tube. All right. Knock, knock, knock.
Hi.
Hi, Joanne. How are you today?
I'm doing great.
Good. My name's Sheena, and I'm the student nurse. I have a physician order here from Dr. Moberg for a nasogastric tube insertion. Have you ever had one before?
Yes, ma'am.
Okay, perfect. I'm going to perform hand hygiene. Go. I'm going to put on my gloves. And okay, Joanne, since you've had an NG tube inserted before, this should be rather easy.
Yes, ma'am. I'm a pro.
Good deal. Okay, Joanne, can you tell me your full name and date of birth, please?
Joanne Jones, 12/3/67.
Perfect. And do you have any allergies?
Penicillin.
All right, perfect. Are you allergic to any adhesives? Because we're going to be applying tape to your nose.
No, ma'am.
Okay, perfect. All right. My assistant, Cassie, is going to have the water for her to swallow once we get going. So, acceptable height. Joanne, are you in any pain today?
No, ma'am. Zero pain.
On a scale from, I apologize, on a scale from 0 to 10, 0 is no pain, 10 is the worst pain you've ever been in. Can you rate your pain for me?
0, no pain.
Okay, I'm going to take this pillow out from behind your head, Joanne, because we're going to need you to tilt your head back and forward and all that good stuff. Okay, I'll take my chuck, and I'm going to set it here. We're going to do a gag bag, just in case. Okay, I'm going to explain the process here. Just because I know that you've had it before, we are going to insert the tube. Joanne, once you have the tube in your nose, I'm going to ask that you take a sip of water. You're going to lean your head forward so it goes straight down. I would check for a gag reflex with the tongue depressor. Joanne, have you had any facial injuries, nose injuries, anything like that before?
No, ma'am.
Okay, perfect. And then if she had, we would still assess up the nostrils, back of the throat, to make sure that it's all clear and nothing's going to obstruct the tube going down. Okay, Miss Joanne. So tube's going to go down, you're going to tilt your head back, we're going to go through. I'm going to change my gloves. First I have to measure. Okay, I'm going to measure from the nose to the ear to the xiphoid process. So, 53. Okay, so I'm going to mark that with a piece of tape. 53. Not too tight because we have to get it off at the end. Okay. my syringe, 60 milliliter syringe at the end. Once it hits that gastric stomach, if any residual comes back out, pushes against, the syringe will be able to catch it and it's not going to go all over us. So I would lubricate with the water 3 to 4 inches up. Good deal. Okay. So we're going to take, and Joanne, you're going to tilt your head back, and we're going to insert once it goes in and she starts to gag. I would stop. I would check the back of her throat to make sure that it's not curling in the back of her throat. My assistant is going to give her some water. She's going to tilt her head forward, and we're going to continue to insert the tube. So we're not catching on anything here. We're going to go right to the tape, the 53. Perfect. I would have asked her to keep swallowing the whole entire time. I'm going to mark the 53 with a marker while it's here. Perfect. And then we are going to take and secure this to her nose because Joanne's skin doesn't allow for it to stick. I would wrap it around. I would hold it up here. Perfect. I'm going to pin, because it's secured to her nose, I would then pin the tube to her shirt. Make sure it doesn't go anywhere. Perfect. How does that feel, Joanne?
It feels good.
All right, and now I'm going to check the residual. A little bit came out when we were inserting, so we are going to hold that. We're going to clamp it here, off. I would take my cup. I'm going to insert the stomach contents into the cup. I'm going to take my strip here. I can get one off there. Perfect. I would insert it into the stomach content. It needs to be between 1 and 4, the acidity for a normal rating. And it is, it's a 3, so that's good. Normal rating. I would get rid of that. Joanne needs to go to radiology to get an x-ray for placement, ensure that it's in the right spot. After that, I would take my gloves off, do hand hygiene, get rid of all my stuff here, document the color of the gastric contents that was in the tube, the pH, how she handled the procedure. Yeah, that's pretty much it for that one. For video purposes, I'm going to be removing it at the same time. I would have left. I walk into the room, assess pain. I would have checked for bowel sounds initially before that procedure, which I forgot to state. And I forgot to state that I would have had her blow out her nose to see what nair was clear and open the most. So I just went through my orders, my rights, verified my patient, Joanne Jones. She's allergic to penicillin. We're taking out her nasogastric tube. I would assess for pain. I would assess for bowel sounds prior to taking it out. So what we're going to do is we are going to, Joanne, instruct the patient on what we are doing today, taking out your nasogastric tube. Dr. Moberg has given those orders, so I would take 10 milliliters of air or saline. I would push the 10 milliliters into the tube to clear the line. Perfect. So I then would take the tape off of her nose, take the pin out, explain to Joanne, we are going to be taking it out. When I start taking it out, a little bit before, I want you to breathe in real deep, hold your breath, and then I'm going to take everything out as quickly as possible.
Okay.
All right. Okay, so ready, set, deep breath, and pull it out. Wrap it all up in this chuck. How are you doing, Joanne?
That wasn't bad at all.
Okay, I would assess it if the patient is NPO, I would throw this in the garbage. If they aren't NPO, I would give them water to soothe their throat. If they are NPO, can't give them any liquid. I would then perform pen hygiene, document how she assessed, how she handled taking the NG tube out. That's it.